Course 3, Accessing Minnesota PMP Data. After viewing the session, you'll have knowledge of who can access the Minnesota PMP database and when it is allowed per statute. The Minnesota PMP contracts with a vendor to collect or manage our database. We've covered the way that prescription data is put into the PMP database in the previous course, which is done through a data repository in our software system we've identified as Clearinghouse. Access to the data is obtained through another portal, and this system is called Aware. Let's talk about types of access. Minnesota Statute 152.126 allows access directly to the Minnesota PMP database to certain types of individuals. Once direct access users have submitted an approved application, they can either log into the Aware database to perform the search, or, if available, search through a system called Gateway. Gateway allows access through a user's electronic health record or pharmacy dispensing software systems with one click. Either method of search queries the same database and presents a view of the same report. More detailed information is available in future sessions regarding Gateway integrated searching. Statute also permits different types of individuals to view Minnesota PMP data, but a request must be submitted to our program for report generation. There are specific forms available on the PMP website for different types of requests. The incoming requests are reviewed by program staff. If all required information and documentation is included, program staff will access the same Aware system and a report is created and returned to the requester in a secure fashion. The following individuals are allowed access directly to the PMP database. Prescribers and pharmacists that are licensed and practicing in this state are allowed access to assist with developing care plans for their patients, reducing the risk of misuse while supporting appropriate treatment. Medical examiners and coroners can access data directly to assist in investigations on decedents related to controlled substances. In addition, staff working within the Minnesota Healthcare Programs Department managing individuals that are restricted to a single provider, pharmacy, and hospital can obtain an account for monitoring compliance of care plans. Each of these role types can also authorize a delegate or agent to search on their behalf. A delegate must create their own account and access is approved by the prescriber, pharmacist, medical examiner, or restricted recipient program director. The supervising account holder is responsible for all searches performed under their authority and must audit searches quarterly. Points to note: only prescriber and pharmacist role types can perform interstate searches. And for all direct access accounts, only the previous 12 months of data are retained for release. Creating a direct access Minnesota PMP Aware account is easy. You can access a link through our website, or you can go directly to minnesota.pmp.aware.net. The process for verification and approval is dependent on which role type is selected during the application process. Once submitted, prescriber and pharmacist role type applications are credentialed electronically. For prescribers, they must have a valid Minnesota license, DEA registration, and NPI that match the demographics entered in the application. For pharmacist applicants, a Minnesota State pharmacist license is verified upon application submission. An NPI is an optional field for pharmacists. If approved, access is immediate. If denied, an email response is sent with additional instructions. Denied applications cannot be revised by program staff. Delegates submit an application for their own account but must provide the email address of at least one supervising Minnesota PMP account holder to search on behalf of. If working with multiple prescribers or pharmacists, each should be added. Once submitted, program staff will review and if complete, the application will be approved. Once approved, the delegate may access their PMP account but will only have access to patient data once their supervisor or supervisors log into their own account and approve their access. Medical examiners and representatives of the Minnesota Restricted Recipient Program applications are reviewed and manually approved or denied by program staff. Let's talk about indirect access. Statute allows Health Licensing Board staff investigating a bona fide complaint to receive PMP data. The request must be based on the matter being investigated. An investigation related to a licensee's prescribing allows release of prescribing history. If the investigation is related to a licensee's own prescription use, they may request the personal dispensation history. Patients or recipients can submit a request for their own controlled substance history. The results can be sent to either themselves or an identified third party. The form must be notarized. A member of local, state, or federal law enforcement can request a report but must have a signed search warrant. Of note, reports will be returned with only Minnesota PMP data. Interstate data is not allowed to be released. And again, the maximum prescription history returned for all requests is 12 months from the date requested. Minnesota law is specific about when it is allowed to access patient information within the PMP database. The following is related to a prescriber of controlled substances in Minnesota. A provider or their authorized delegate may permissibly access PMP data for a current patient to whom the prescriber is prescribing or considering prescribing a controlled substance, or providing emergency medical treatment for which access to the data may be necessary, or providing care and there is reason to believe, based on clinical indication, that the patient may be abusing a controlled substance. Additionally, if providing other medical treatment and there is a clinical purpose that the data may be necessary, they may access the data after obtaining and documenting patient consent. Pharmacists may permissibly access Minnesota PMP data while assessing a current patient to whom the pharmacist is dispensing or considering dispensing a reportable substance, or if patient consent is obtained and the pharmacist is providing pharmaceutical care for a patient and access may be necessary. If the pharmacist is in consultation by a prescriber who is requesting the data in accordance with their permissible use clauses, consent is not required. For example, a pharmacist is doing a medication consolidation review. They must obtain patient consent. If a prescriber has a question about a PMP report and contacts the pharmacist for advice or guidance, the pharmacist may access the patient's PMP report without consent. A couple important notes regarding permissible use. Though some states have language in their statute that specifically allows access to PMP data for research purposes, Minnesota Statute Section 152.126 does not. Access is only permissible for one of the previously described use cases. Statute does not prohibit or permit an authorized Minnesota PMP account holder to search their own PMP history. Delegates do not have individual authority to determine when a PMP report should be accessed and should not access their own PMP history. The Minnesota PMP has provided guidance documents in the form of FAQs. However, we are unable to provide legal advice. For specific instances, please contact your available legal or compliance resources. Resources related to access to data and permissible use can be found on our website at mn.gov/boards/pharmacy-PMP. Select the tab Forms, Resources, and Help. Under Answers for PMP searchers, you can find Frequently Asked Questions pages. FAQ documents are available for data access, understanding the report, patient alerts, and help with delegate management. And as usual, there is a button to contact us with any questions. The next recommended course is number 4, Interstate Access to Minnesota PMP Data. Thank you for your participation.